Yep, there it is.
Okay. Hi, everyone. Welcome to Stream 1, Awakening Our Communities, Session 4, Avoiding Harm, Family Violence, and Trauma-Informed Care with Elvira Truglia. If you are in the wrong session, please navigate to your session you are looking for on the left of the screen. Click on the Sessions button and then click the session you would like to attend. Elvira is the project lead of the Midwives Recognize and Respond to Family Violence project. She is happy to bring her background in advocacy, strategic communications, community development, and project management to this role. Her work experience spans national and international civil societies, arts and culture organizations, and media outlets. Elvira has led programs and projects related to gender-based violence, social justice, and human rights. She is a proud mama of a teenage daughter who keeps her grounded. Welcome, Elvira. We're so happy to have you here today.
Thank you so much, Kim, for the introduction and also for the invitation to participate, and to all the Hope Conference organizers. So maybe just to reiterate, my name is Elvira, and my pronouns are she, her. As Kim mentioned, I'm the project lead of, as you see on the screen, the Midwives Recognize and Respond to Family Violence project. And I'm joining you from the unceded territories of the Kanien'kehá:ka Nation. And I really do consider it a privilege to speak with you today about our project and the theme of this talk, avoiding harm, pregnancy, family violence, and trauma-informed care. Before getting into the nitty-gritty, I wanted to start by sharing a bit of background. So in a survey conducted about a couple of years ago, the members of the Canadian Association of Midwives and the National Aboriginal Council of Midwives responded that they consider supporting clients who face abuse part of midwifery practice. And at the same time, as you could imagine, addressing family violence was named as something that is challenging. So some midwives feel and still feel that they don't have enough knowledge about intimate partner violence or children's exposure to IPV. They feel that they may not have the connections to the right community resources to be able to recognize abuse or appropriately support clients. Other midwives pointed out that they hesitate to respond because they don't want to create more harm to their clients. And all midwives agree that there's a need to practice trauma-informed care. So throughout this 3-year project, we've worked to really break the taboo of family violence and to construct what it means to practice trauma-informed care in the context of pregnancy and family violence. And so we're doing this work in partnership with the National Aboriginal Council of Midwives and the McMaster University Midwifery Education Program. It's a project that's funded by the Public Health Agency of Canada. And really the overall goal of the project is to build midwife capacity to recognize and respond to family violence, hence the name. But before talking about how we're doing this, I wanted to talk a little bit why we're doing this. And again, putting things into context. Research on IPV and pregnancy reveals that abuse can actually begin, increase, or decrease during pregnancy or postpartum. And the rates reported are between 6% and 10.5% during pregnancy. So we do know, and as we've heard throughout the conference today and during the other conferences, that abuse can happen to anyone. And it could also happen to pregnant women and gender diverse folks. At the same time, pregnancy and IPV remains like a hush-hush topic, despite its prevalence. And we do know also that midwives can have a front row seat as witnesses. So, again, before going into the nitty-gritty of, what are we doing in this project, I want to share some reflections about how midwives describe in their own words what it means to be on the front lines of this work. So here's one quote, and really as primary healthcare providers with privileged relationships with clients, midwives know that they can play an important role in breaking cycles of violence in families. So that's an important perspective. And also in doing their jobs, many midwives are aware of the power dynamic between themselves and their clients, and really the importance of using a client-centered approach, again, that avoids creating or increasing harm, which is one of the themes of this project. On this third slide, and it is another theme that has come up quite a bit, is recognizing that the root causes of violence, as I think we all know, are systemic, and they're connected to all the isms and to socioeconomic inequalities. So, in doing this work, midwives realize they need to be aware of structural violence in order to support clients appropriately. But of course, this needs to go hand in hand with policy changes. The quotes I shared are from midwives who responded to the knowledge assessment survey that we did at the start of the project. And sort of keeping in mind sort of this overview, or what I want to share is sort of an overview, which is a snapshot of our project activities. And then I'm going to go into them a little bit in more detail. But what we've done and are continuing to do is, we started off with the development of a knowledge assessment survey, and that informed all of our project activities. We've developed an undergrad curriculum for midwifery students. We developed 2 sets of professional development workshops, one for Indigenous midwives and one for all midwives. We are still in the process, we've actually developed them, but in the process of designing a suite of modular clinical resources, including a graphic novel for clients. And of course, we're doing ongoing awareness raising activities like speaking with you here today. So now I'd like to give you a few more details about some of these activities in the next few slides. So bring it back to this being a capacity building project. The 2 main components are training and resource development. So through these activities, what we've wanted to do is reach 3 kinds of learners: undergraduate midwifery students, practicing midwives, and Indigenous midwives and students. And we've reached these learners by developing and delivering the 3 training programs that you see on the right-hand column of this slide. And I will briefly speak to each of them in the next few minutes. So first, addressing family violence in perinatal care. This is a modular course developed by our partner, the McMaster University Midwifery Education Program. And so far, only McMaster students have benefited from this course, but we are in the process of working towards other midwifery programs picking it up in the future. Some results to date. So since 2021, about 79 students have completed the course. That's around 66 midwifery students and 13 students from studying other health professions. Students learned about health equity, trauma, safety, IPV, and child maltreatment, as well as working with institutions and vicarious trauma. So what did students think about this course? As you can read on this slide, students say the course is meeting a need. They're building skills. They like the approach of the course and the various perspectives offered. And these are perspectives offered by the facilitators of the workshop, but also the various faculty members that were invited as guest speakers during the course. And maybe to just go back to this slide, a note that there is going to be another round of these of the course being delivered live in person, in the month of April. So in the next few weeks. So to reach the other learners that I mentioned, we also developed 2 sets of professional development workshops. And on this slide, you'll see the comparison of topics and approaches that we use to deliver the trainings to all CAM members versus Indigenous midwives and students specifically. So you'll note on the slide that the CAM workshops are scenario-based, and the scenarios and other learning activities are really used to elicit reflection and discussion. At the same time, in addition to discussion and using peer discussion to talk about scenarios, we offered practical tools that midwives can start immediately using in clinics. On the right-hand column for the Indigenous workshops, these were designed as very much discussion-based learning and sharing circles. And sort of the assumption behind the workshops is that all participants have had direct or indirect experience with violence. And so to create a safer space, there were no scenarios used in these workshops. And each discussion circle had a theme, but topics really vary depending on who the facilitators were and participants in the room. Learning in this case really focused on sharing stories and also sharing resources. What did participants of these sessions think? For the Indigenous midwives, the person quoted on this slide says that they liked how the facilitators shared their own mistakes with humility. And this participant said that this is how we learn from each other. By building on each other's experiences, we are less likely to make the same mistakes, and our collective learning is our strength. So the person quoted clearly appreciates the aspect of sharing and collective learning. And this was designed intentionally in order to make the workshops culturally appropriate. And in terms of the CAM workshops, what did participants think? So the person in this slide said that they learned safer ways to support people without going towards institutions that have historically created harm. And when those institutions need to be used, they learned how to go about using them in a way that fully involves and supports the client. And still quoting, I also think that it has shown me how much I need to learn, but I feel I have a really good starting place with the resources that have been provided. So again, the participant clearly appreciates the approach of the workshop and the resources provided. And they acknowledge being an ongoing learning mode. In terms of the impact of these modules, like in numbers, you'll see on this slide that 66 midwifery students completed the midwifery education course, and 13 of these students were from other health professions. 59 practicing midwives went through the professional development workshops. 2 of these were delivered online, and 2 were actually delivered in person. 1 was in Toronto and 1 was in Vancouver. And 23 Indigenous midwives and students participated in the learning circles. So I'm not sure if these numbers seem low or high, but from our perspective, they are relatively modest. But the important thing to us is not so much the numbers, but the approach behind these learning modules. And that's where we're hoping that it will impact clinical practice and really have cumulative results over the long term. So, I mentioned sort of a little bit around the approach to our sessions, but I kind of wanted to spend a little bit more time in unpacking those, unpacking the approach a little bit, because really our approach centered around 3 pillars, and underpinning that was the theme of avoiding harm. So health equity and social justice, centering Indigenous, Black, and people of color communities, and being trauma informed. So that's really sort of a synthesis of our overall approach. In terms of health equity and social justice, really through the lens of health equity, we know that health outcomes are connected to the social determinants of health. And so this means not just looking at health from a biological perspective, but really looking at the socioeconomic inequities that can set people up for poor health outcomes. And these can be factors such as poverty, discrimination, racism, sexism, ableism. And the social scientist, Rebecca Plett, who is actually one of the facilitators of the McMaster undergrad course, she shares that there's really little effort to link social analysis to clinical practice. And she wants people to remember that structural violence has everything to do with health. The pandemic, of course, is a perfect example where everyone saw how the most vulnerable populations were the most impacted by COVID. And, Rebecca says that the way to close this gap in health outcomes is to think of equity as an equity. Think of health as an equity question. And so what does this look like? It would mean that healthcare services should prioritize the most vulnerable first, since they are the ones that are the least shielded from illness. In a nutshell, it means that healthcare is a social justice issue. And from our perspective, this is very much a radical perspective. It's a perspective that we would hope gets implemented across the healthcare system. In terms of our other pillar, we know that structural violence produces disproportionate negative impacts on particular groups and communities. And I know other sessions have talked about the legacy of colonialism and residential schools and intergenerational trauma. This is now widely recognized. And this legacy translates to poor health outcomes for Indigenous people compared to non-Indigenous. Similarly, Black communities and other people of color communities are impacted disproportionately by systemic violence. And so, throughout this project, the student and professional development learning modules, as well as the resources, really shine light on the lived experience of Mbak communities and really back to this need to include social analysis in clinical care. So finally, the third pillar is around providing trauma-informed care. And I think a lot of people know that, at the heart of trauma-informed approach to healthcare is stripping it down. It's about meeting people where they are at. But we've asked, what does this look like for midwives? How do we meet people where they're at as midwives? And it's really been a recurring topic of conversation in all of our project activities. Whether it's the development of curriculum or training methodology and materials, and as well as in our resource development. And, some questions that keep coming up, and you'll see them on the slide in brief, is, how can you teach midwives about the duty to report if they suspect child maltreatment, in the context of the legacy of residential schools and the overrepresentation of Indigenous children in the child welfare system. Another question, should midwives systematically ask their clients about family violence? And yet another question, if a client has disclosed IPV, should a midwife counsel their client to leave their partner? So these just keep coming up again and again. And really, there are no simple answers. And so I'd like to sort of paraphrase and quote Carol Cucci, who is one of the Indigenous midwives and facilitators and educators on this project. And she really talks a lot about the gray areas in doing this work. And she says that if you can gear your care based on the assumption that most people have experienced violence to some extent, that is this that will guide you on, the question of whether to ask. When is it appropriate time to ask? How to ask if you're going to ask. And, give a concrete example of how this, these gray areas play out. I'd like to share an anecdote that really keeps coming up in our workshops and also directly when facilitators speak about their experiences as midwives. And, it's an anecdote about whether or not people are ready to leave an abusive situation. So often a midwife will suspect that something is going on, in the client's private lives, but the clients keep saying, things are okay, things are okay. It might only be years later that clients come back to the midwifery clinic because they're pregnant again, and they share that they've left their abusive relationship. So in one example, a client told the midwife that she couldn't bring herself to disclose, and this was like years later when she saw the midwife again, she couldn't bring herself to disclose what was happening at home because She couldn't first admit it to herself. She wasn't ready to leave, but it was thanks to the concern shown by the midwife and also the resources that were shared that eventually she did leave. But it wasn't immediate, and it certainly wasn't black or white. Again, this is illustrating the gray areas in this work. And in terms of how to navigate those gray areas, again, I like to defer to Carol. And she says that the best you can do is to be kind and to be ready, to have your resources ready, to have your kit ready. She calls it an emergency kit. And whether that's your kit to make referrals to community organizations or to legal organizations or social services, or whether it means to, at the end of the day, help people meet their basic needs. And another guiding principle is to expect to make mistakes. It's something that she knows from experience and that she shares with other midwives and students, that they're not going to get it right all the time. They're going to make mistakes, but that's something they're going to have to learn to do better. Learn to do better the next time. So I spent a lot of time talking about this because midwives really do feel a lot of pressure to get it right, and often some of the questions that we'll get is, well, like, what is the right approach to doing X, Y, or Z? But the truth is that there is no one right answer. It's something that midwives will have to figure out with their clients, because at the end of the day, it's the client that has the agency, or the perspective of the midwife is that wants to ensure that the client knows that they have the agency. And so sometimes that means that a midwife might be left feeling a little bit uncomfortable, and that's just part of the work. So I'm going to shift gears a bit and turn to, I've talked a lot about our learning modules. I want to share a little bit about our resources, because of course, learning happens in many ways. Some prefer structured learning, and some prefer peer discussion, some prefer self-study and reflection. And on this slide, you'll see the adapted cover page of our graphic novel. It's called Something is Off. It's currently available in English and French, and it could be read online. It could be downloaded. It can be printed. And coming soon are Spanish and Arabic versions. They're in the works. And it's a short graphic novel, and it's centered around two scenarios. In one scenario, a client is experiencing physical violence. In the other scenario, it's in a situation of evolving emotional abuse. And while reading the scenarios, you'll also be introduced to informational material about IPV. It's 36 pages long, and it's intended for clients as well as for midwives. In a moment, I will share the link to the graphic novel in the chat in case you're interested. But really what we're trying to do with this very accessible resource, our aim is to encourage midwives, but also other health professionals, social service providers, and community organizations to share and to spread awareness about IPV and trauma-informed care. The intention for clients is, on the client side, is to raise awareness and to encourage reflection. I realize that I'm going to have to put the link in the chat in a moment, but I'll do it at the end, put a link to the graphic novel in the chat. So that's our graphic novel. We're very excited about getting that out into the world. But in addition to that, we also have a modular suite of clinical resources that will be launching soon, and they're going to be in English and in French. And these resources are really conceived to build understanding about recognizing and responding to family violence, but they're also conceived as practical tools to use in clinic to support client care. So today, I just want to give you like a preview, and this is sort of a version of what they're going to be looking like. It's a preview of some of the resources that are going to be published on a webpage in the coming weeks, and it really is probably the final count around 16 resources, so a lot coming down the road. I started giving you an overview of our project and the different activities and our approach. And, it's, there's been a lot of learning along the way, learning and reflections about the content as well as the process, from the project management perspective as much as from the content development perspective. And I thought it might be useful to kind of share some of these learnings and takeaways. Some of them may resonate with you. And, I'm going to keep them really short in the interest of time. So that first piece is around building on strengths and centering community knowledge. And, this was represented in the content itself, as well as making sure to pull in the right people in content development. And, many different people have been involved, including midwives on the project advisory committee. Another takeaway, which I shared a little bit about earlier, is about the impact of learning through storytelling. And we did that through learning scenarios, again, back to sharing of experiences and peer learning. And what all of these things have in common is that they're person-centered approaches. And that's really important because it aligns super well with what we call in the midwifery scope of care, this concept of informed choice and continuity of care. So it's very much person-centered. The third learning or takeaway is the need to design learning resources and activities for different learning styles. And of course, this is something that's ongoing. And as we do things, no, that didn't work so well. What do we need to do differently? But it's something that we were being intentional about, is always trying to adapt to the needs of our learners. And on the point number 4 is really about working, when doing this kind of work, you're going to be working with a lot of partners, there's going to be a lot of stakeholders, and it's really important to have value alignment. And, this is a funded project. It also includes nurturing a very strong funder relationship with open communication channels. Why? Because if hiccups come up along the way, it's important to take a pause and to get back on track, referring to your shared values. So I think it's worth mentioning the importance of the shared values. And the 5th point on this slide is bringing it back to the beginning, the need to be trauma informed. And this is really from, at all levels, from project conception to the design and implementation, and also within and across all teams and stakeholders. This is not easy work. And, our working definition of trauma informed is that trauma is pervasive and, in our various roles, whether as midwives or otherwise, we need to use approaches that don't re-traumatize people. And at the end of the day, if all else fails, we just need to remember to be kind to each other. And sometimes that might be easier said than done. And I wanted to leave you with that as sort of a final thought. And just want to, thank you for listening and invite you to take a look at our graphic novel and to stay tuned for our new resources in the coming weeks. And I'm also excited to see if you have any questions about the project.
If you have questions, you can put them in the Q&A and I'll be monitoring that. I wanted to say, so I started my career as an instructional designer and you just made my day. So all of the work that you did to understand the different audiences and create learning materials that apply to the different scenarios, taking into consideration people's lived experience and how it might impact them in the classroom. I just want to say kudos to you for that effort and work, and how well your presentation sort of clearly defined the steps that you took to do that. And sort of the impact that it had. So the examples you gave around the one classroom had scenarios and the other classroom was more theme focused and looking at storytelling. It's a great way to really look at your audience and what they need. So one thing, you were just talking about stakeholders a few minutes ago, and I know that that's one area which can be very challenging for groups who are working on these large projects to engage stakeholders. So what is some advice that you have for a group that is currently trying to engage stakeholders to do a project, whether it's to design training or really anything? And tell us a little bit about how you went through that process.
Thanks, Kim. That's a great question. It's also, I would say that I'm going to quote Carol around, the gray areas. I don't think that there's like one path to that. And you spoke about audiences. It's about knowing your community, knowing the people that you're working with and what's going to work and what's not going to work. But like as a general principle, it's listening. That's the key. Right, is listening to everyone's perspective, and that's why I put in that point around value alignment, because if you can actually bring people in a room that may have different perspectives on how to get something done, but you agree on, well, we're sort of all share this principle of why we're doing the work, then that's going to take you leaps ahead in the process. Because sometimes you get caught in the weeds of, well, no, I think it should be this, and no, I think it should be that. But at the end of the day, you have to find a way to bring it back to, well, why are we doing this work? And what are our commonalities? And again, like I mentioned, for this project, we are in partnership with the National Aboriginal Council of Midwives and McMaster University. And it's about also giving everyone space to actually follow their internal processes and what's their truths, how they do the work, and find, like, again, where you have the bridges that you can create bridges. In the case of the McMaster course, what was interesting is that the group, the team of people that put together the undergrad course at McMaster, there was a lot of overlap with the team of people that also helped design the professional development materials. And so there was continuity. So I don't know if that clearly answers your question. I think it is value alignment, creating the right spaces, and kind of not, and I think a really important thing is to not be afraid to pause when you need to pause. Like something's not working, take that pause and regroup.
I think that's incredibly important, and it's really how you continue to build those relationships. So stakeholders don't always agree. They don't always come with the same point of view when they arrive at the table. And sometimes there's like negotiation and understanding. So I really like how you're positioning that as value alignment and sort of going back to the purpose that you're all there in the first place. So, we all bring different approaches, different ideas, but if you stay focused on that value alignment and where you're going, that's going to keep you all sort of focused on the sort of the north light, right? Like North Star is what I'm trying to say. I loved how you talked about the gray areas as well through your presentation. What do you think was the greatest learning about the gray areas as you were going through this process?
That they're just going to keep coming. I think I was listening to another session just before this one, and the presenter was quoting one of her mentors and said something to the effect of, there's no right or wrong, it is what it is. And I think this is one of the messages that really has come through really, really clearly in all of our materials, all of our resources, all of our trainings, is this idea of not being judgmental and taking that perspective, like there are no sort of heroes in this work. It's you have to give space for the lived experience of the person that's going through what they're going through. And so if you have that perspective, that it's about, from, you know, speaking of midwifery and the relationship between midwives and clients, it is that it's the client's truth that's important. And as a midwife, midwives are there to support their clients, and you know, not to be prescriptive, and to really understand this concept of health equity. And I really think that that's, like, if there's one thing that I think could radically change things is understanding that, of what health equity actually means, and how health outcomes are really linked to systemic inequalities. And you know, I think that concept, if it was applied to healthcare and it was applied to other sectors, there'd be a lot of changes, right? Because it's about sort of getting out of the silos. There's so many silos, and if you start to see the connections between things, that's where change happens.
That's a really important point. Absolutely. Well, thank you so much for your presentation today. I don't think we have any other questions at this time, but it was a very informative, and it's very important work that you're doing. And I'm so glad that you've undertaken this project, and please share the links to the graphic novel, and we'll make sure that gets out to everybody so that they can see that. So thank you so much for your session today.
Thank you so much, Kim, and thanks to everyone.
Okay.
Good luck.
Thanks, everyone. Bye.
Bye.